Full mouth implant treatment is for those patients whose all the teeth are either so loose that they cannot be saved, or they are so broken that they cannot be repaired, or for somebody who has lost the teeth for a long time and they have been suffering from ill-fitting dentures. The way this treatment is done is that we place 4 or 5 or 6 according to the amount of bone that they have. We put 4 to 5 to 6 implants in one jaw, and we make a fixed bridge that sits on those 4, 5 or 6 implants, and it's fixed permanently, and it's constructed right here in our lab and delivered to the patient's mouth in 3 to 4 days. So this is full mouth reconstruction when every tooth is coming out of the mouth. It's the most cost-effective treatment because it's the implants are placed in the available bone. You don't have to do any kind of bone grafting in there. You don't have to go through prolonged multiple visit treatments. So it's a very cost-effective treatment. It's fast, it's comfortable, and it's predictable.